Hello and welcome to this session, Learning Outcome 3 with the title Understand Symptoms, Diagnosis, and Treatment. Diabetes affects millions worldwide, but do you know the symptoms? This video explores the signs, diagnosis, and treatment of diabetes. Let's dive into the details of this prevalent condition. Type 1 diabetes symptoms often appear suddenly and are severe. Key signs include excessive thirst, frequent urination, and extreme tiredness. Unexplained weight loss and blurred vision may also occur. In severe cases, diabetic ketoacidosis can develop, which is life-threatening. Early recognition is crucial for timely intervention. Type 2 diabetes develops gradually and might be mild initially. Increased thirst and urination are common symptoms. Tiredness, slow healing wounds, and recurrent infections may occur. Some individuals experience blurred vision or no symptoms at all. Routine checks often lead to diagnosis. Gestational diabetes often shows no noticeable symptoms. Sometimes increased thirst, frequent urination, and tiredness appear. These symptoms can be confused with normal pregnancy signs. Usually, it is detected through screening tests during pregnancy. Monitoring is essential for managing gestational diabetes. Blood glucose tests are key for diagnosing diabetes. Fasting blood glucose and oral glucose tolerance tests are common methods. The HbA1c test shows average blood sugar levels over months. Random blood glucose tests can also indicate diabetes. Gestational diabetes is diagnosed through OGTT during pregnancy. Type 1 diabetes requires lifelong insulin therapy. Regular blood sugar monitoring is crucial. A healthy diet and physical activity help manage the condition. Education and support are vital for effective management. Patients need to balance insulin with food intake and energy use. Lifestyle changes are the first step in treating type 2 diabetes. If blood sugar remains high, oral medications like metformin are prescribed. Insulin or other injectables might be needed in some cases. Monitoring blood sugar, blood pressure, and cholesterol is essential. Education programs support ongoing management. Gestational diabetes is managed through diet and exercise. Regular blood sugar monitoring is essential during pregnancy. Some women may need insulin or medication. After childbirth, blood sugar usually returns to normal. Long-term monitoring is advised to prevent future complications. Diabetes symptoms include frequent urination and excessive thirst. Extreme tiredness and blurred vision are also common. Slow healing of wounds and recurrent infections may occur. Unexplained weight loss is particularly seen in type 1. Recognizing these symptoms can lead to early diagnosis. Type 1 symptoms appear suddenly and severely. Type 2 symptoms develop gradually and may go unnoticed. Gestational diabetes often shows no obvious symptoms. Routine screening tests are crucial for gestational diabetes detection. Understanding these differences aids in timely diagnosis. The fasting plasma glucose test measures blood sugar after fasting. A result of 7 mmol/L or higher indicates diabetes. This test is reliable for screening type 1 and type 2 diabetes. It requires at least 8 hours of fasting. Early detection through this test is vital. The oral glucose tolerance test checks how the body handles glucose. After fasting, a glucose solution is consumed. Blood sugar is measured after 2 hours. A reading of 11.1 mmol/L confirms diabetes. This test is essential for diagnosing gestational diabetes. The HbA1c test reflects average blood sugar over 2 to 3 months. It does not require fasting. A result of 48 mmol/mol indicates diabetes. This test provides a long-term picture of glucose levels. It's widely used in clinical settings for monitoring. The random plasma glucose test measures blood sugar at any time. A result of 11.1 mmol/L suggests diabetes. It's used when symptoms like thirst and weight loss are present. This test offers a snapshot of current glucose levels. It's part of routine diabetes screening. Urine tests check for glucose, ketones, or protein. C-peptide tests help distinguish between type 1 and type 2 diabetes. Autoantibody tests are used if type 1 is suspected. These tests support accurate diagnosis and management. They are not used for diagnosis alone. Type 1 diabetes care involves lifelong insulin therapy. Regular monitoring of blood glucose is essential. Diet and lifestyle adjustments support insulin management. Education programs empower patients for self-management. Early recognition of complications is crucial for effective care. Type 2 diabetes care starts with lifestyle changes. Oral medications are added if needed. Insulin or injectables may be introduced later. Regular monitoring prevents complications. Education programs support ongoing management and self-care. Correct. Gestational diabetes care focuses on diet and exercise. Regular blood sugar monitoring during pregnancy is vital. Medication or insulin is prescribed if lifestyle changes are insufficient. Post-delivery, blood sugar usually normalizes. Long-term follow-up checks are important for future health. Diagnosis is through HbA1c, fasting glucose, or OGTT. Initial care plan includes education and lifestyle advice. Ongoing management involves regular monitoring and annual reviews. Complication prevention focuses on early risk identification. Patients are encouraged to self-manage with support. Type 1 symptoms appear suddenly. Type 2 develops gradually. Gestational diabetes is often symptomless but detected through screening. Diagnosis relies on blood glucose and HbA1c tests. OGTT is crucial for pregnancy. Together, these approaches ensure accurate detection. Type 1 diabetes requires insulin for life. Type 2 is managed with lifestyle changes and medication. Gestational diabetes is managed during pregnancy with monitoring. Care pathways involve diagnosis, education, and complication prevention. Ongoing support is essential for effective management. In conclusion, understanding symptoms, diagnosis, and treatment is vital for effective diabetes management. Early detection and appropriate care pathways lead to better outcomes. Stay informed and seek guidance from healthcare professionals. In closing, thank you for watching this video. If you have any questions, please send us a message on WhatsApp at 07484361688. Thank you for your attention and goodbye.